I adjusted her earlier. We tried to film it, but forgot to hit the
Dr.
record
Kulla's
button.
a little over.
Yeah, I'm a little challenged today. I forgot to hit the record button. All right, Dr. David Kulla here with Synergy Wellness in New York City. Bear with me, folks, on the sound. We're shooting from an iPhone. Our camera's malfunctioning. But today we have Taylor's mom, Gina.
Yes.
Taylor has been in some of our videos, but for some reason, she hasn't seen them.
I'm a little insulted.
She's a little insulted right now. We're going to have to feature her in our next video. For sure, next time, okay? When she can do her hair and stuff like that. She's got a little bedhead today. So, Gina here, she's done her hair, so she's all good to go. She's ready to film today. I'm just kidding. I'm giving them a hard time. Gina has a frozen shoulder and cervical pain, neck pain, okay? Cervical region of the spine is the top 7 vertebra in the neck, thoracic spine from here to here, and then the lumbar spine. So she's got some cervical or neck pain along with shoulder pain. The shoulder is really the main issue here for her. So she has not been adjusted in decades. Right? Decades? Is that? Sorry.
Oh, you're getting the gun too now.
Oh, no.
It's only been like 1 decade. She's what, 2 decades old now? Now, she's had a frozen shoulder now for 8 months. The longer a frozen shoulder goes without being treated, the worse it gets and the longer it takes to fix. So if you have a shoulder where you just can't really raise it, a frozen shoulder, that's why they call it frozen shoulder, then get that addressed right away. Don't let that fester for 8 months.
I told her.
See?
I
Listen
kept
to your
telling
daughter.
her, go to Dr. Kulla, he's amazing.
And she's probably been hearing that her whole life. Listen to your mom. Listen to your daughter now.
Thank
okay?
you.
Okay. So, your first adjustment. You ready? Okay, take a deep breath in. And blow all the way out. Good, and relax your shoulders here. Okay. All right. Now, we can adjust her with her on her back, although it would be easier for her. She can't cross her arms. It's very hard for her to lift her arms. So we'll have to do it this way in the beginning, and with each adjustment, we'll get more and more motion from the thoracic spine. Good, and another deep breath in. Good, pull all the way out and just relax here. Okay. And turn over on your back. So, folks, it's her left shoulder that's limited. And you guys will see right now, you may not be able to tell, but you'll see in a few seconds here how she's just really limited in her ability to move her arm up and forward. And relax yourself here.
Oh.
He's gentle though.
And relax here.
Oh.
Yeah, there's some doctors, some chiropractors that adjust the neck a little violently. You know, if you've been to a couple chiropractors, you know what I mean. I like to do it a little bit more on the finesse side. There's no need to be violent or rough with it. If it doesn't go, it doesn't go. It's not supposed to. You're probably on the wrong segment. You're making a mistake in the first place. So you shouldn't need a lot of force to perform an adjustment on the cervical spine and the neck. So that went pretty easy, as you can see. Okay, now we're going to start to treat your left shoulder. Okay, so we're going to start with a little GRASTON, and that's this tool right here. Okay, just to loosen the muscle up. And listen, it's going to be a little bit uncomfortable.
Oh no.
I've seen you do this on YouTube.
You have, okay.
Yes.
You've seen my. She's a YouTube subscriber.
Yes.
Okay, don't let those come out, because then we're gonna have a wardrobe malfunction, like the Super Bowl, you know. Start calling you Janet Jackson.
Oh my God.
Okay.
It's gonna hurt now.
And me, Justin Timberlake. Okay. So we're gonna slide this sleeve up. Yep.
Oh no.
Okay, good. And just relax your arm. Mm-hmm.
Fat arm.
It's okay.
Okay. So she complains of having a lot of pain in the front here. Now these are called IASTM, instrument assisted soft tissue mobilization tools, and they're very effective. You can buy them online, but you should know how to use it before you go and buy one online, okay? You don't have to get the expensive brands like this one, like the Rock Blades, or there's GRASTON, the originator of the technique. You don't have to do that. There's all sorts of cheaper versions on Amazon. But again, make sure you know what you're doing. And you don't want to use too much force. And you want to also go in different directions. So you'll notice here I'm going in different patterns here. And the idea here is it's going to make it a little red for skin. It's supposed to. Brings more blood flow to the area. Causes ecchymosis. And how you doing here so far? You okay?
Mm-hmm.
A little painful?
Mm-hmm.
Well, the freaking shoulder's been stuck like that forever.
Yeah, I mean her shoulder, just so you know folks, her shoulder's painful already as it is when she came in.
Oh yeah.
So yes, what I'm doing is a little uncomfortable, but she's already in pain. So you know that saying, no pain, no gain? Huh? It's so true.
Well, if anyone can fix it, you can.
Yeah, we fix a lot of shoulders here. The
Yeah,
shoulder is the most unstable joint in the human body.
Is it really?
Yeah, because it's only connected, it's the only joint that goes 365 degrees, right? So you can go in every single
Really?
direction, and it's only held to the axial skeleton via your clavicle,
Yep.
right? Your collarbone. So it's really the most unstable joint in the human body by far.
No, I remember when I first started coming to you, mine would click. I couldn't raise it all the way. And when you started adjusting, it was so much better.
Yeah, so we didn't have to adjust her clavicle today. I adjusted her earlier. We tried to film it, but forgot to hit the
Dr.
record
Kulla's a
button.
little over.
Yeah, I'm a little challenged today. I forgot to hit the record button. And she's mad at me still for it. So we're gonna film. We're gonna film her next.
It's okay.
The next time we see her, we will film
It's okay.
because her story is really great. It wasn't just a shoulder problem; it was costochondritis. But we're not going to get into that. But she's got a great story, and I promise you, folks, we'll get it on video. Okay. Right now, it's Mama Bear's time.
Mm-hmm.
Justine goes, oh yeah, she's
Just
gonna be
going
bruised.
Different directions. Do you bruise easy?
No.
No? Okay. And you can ask the patient that if they bruise easy, maybe just go a little bit easier.
Yeah,
You know.
I bruise like a
Okay,
thief.
now, I'm gonna have you just relax the arm there. Good. So sometimes it's frozen shoulder, and sometimes it's frozen shoulder and a subluxated shoulder, meaning the shoulder is out of alignment. And that is what we're dealing with here. We're going to do our best to try to get an adjustment in there, but when you can't move the arm, it limits a little bit of what we can do the first visit. And this is obviously our first visit here. So what I'm going to have you do is slide up. Yeah, a little bit more. Good. Okay, great. Okay.
Oh.
You're okay?
I'm gonna
Okay,
adjust
we're
the
supposed to
clavicle.
do that, yep. Okay, look that way. Yeah. And smile for the camera. See that beautiful smile under that mask, folks? See that? Okay, and take a deep breath in. and blow out. Okay.
Welcome to my world.
I felt that go back in. Did you?
I felt something.
Yeah, you could feel it go right into place. I definitely sensed that on that adjustment. So now I'm gonna have you sit up and face the camera. Swing your legs to the side and sit right on this cushion right here.
Right up there.
Can I pull this down or no?
Okay, yeah, you can. Go ahead and bring your arm up as high as you can.
This in front of
Yeah,
me?
yeah. Okay, all right, that's about another 10-15 degrees. Now I want you to bend your arm like this.
Oh,
And go up
on.
with it. Go up with it on this side.
Like, try to raise it. Jesus. Oh boy.
Okay.
That's bad.
All right, still pretty.
It's in here.
Yeah. Okay, relax there.
Oh, here comes the gun.
Oh, I hate that thing.
I told you. It's breaking
You
it
know,
up.
it's funny. She says she hates this thing, but she's never even had it before used on her. This is her first adjustment.
Well, she,
So
That's
how do you
true.
hate this thing?
she heard me say that. Because when I'm
Okay,
sore,
she's been watching.
because when I'm sore, it does hurt.
Okay, she's
It's
been
not-
watching her daughter get adjusted, so she has an opinion on something she's never even tried. See? Folks, if you have an opinion, you folks watching this video on chiropractic and you've never tried it, wipe that opinion out of your mind. And if you have tried chiropractic and have a bad opinion of it,
Then you just need to try Dr. Kulla. That's
or
it.
go to another chiropractor, okay? Just like a dentist. If you go to a bad dentist, do you write off dentistry and never go to the dentist again? No, you just find another dentist that you're comfortable with that's good, right? Good there? Okay. Okay, lay on your back.
That felt good.
Can't, you know, her arm is limited in the motion. We're just gonna take it here to 90 degrees. Okay, all right, now sit up again, face the camera. Swing your legs to the left. And have a, okay, now go ahead and raise that arm up for me.
Oh, it feels better.
Okay.
Wow, look how much more mobility you
Yeah.
have.
Good, another 5-10 degrees. Okay, now move it up in front of you. Okay. All right, we got some work still to do. If you have a frozen shoulder, go get it checked out and get it
Because it'll
taken
get
care of
worse.
right away.
I should have come sooner.
Yeah.
My dermatologist
okay.
had
Better
it,
late than
and
never.
She needs surgery now because she had
Your
a frozen-
dermatologist.
She
Now
had-
she's got calcific tendonitis. And,
It turned into she has a rotator cuff tear and everything. She needs
Yeah.
surgery because she let it go.
don't let that fester, folks. Thanks
Come
for
see
tuning
Dr.
in.
Kulla.